Hi, this is Dr. Doreste with the Cranial Release Technique. Back with another video, this time something a little bit different. We're going to sort of follow up on last week's video where I was asking the question, how do you know if you got the cranial release technique done correctly? You as a practitioner, how do you know what tests could you do? And again, as you recall in the last video, any test that you're currently doing is valid, whether it's leg lengths, whether it's muscle testing, reflexes, static palpation, motion palpation, whatever type of practitioner you are, reflexes, excuse me, doesn't really matter because I'm expecting that after you complete the cranial release technique, the patient's pre and post test, before and after test will improve, regardless of what it is that you just did. Again, if you're watching this on YouTube, you can hit the like, the share, and subscribe button. Send this to your friends and family so that we can get the word out so they can learn more about what the cranial release technique is all about. Okay. So again, I think you've seen this poster. This is what I give to my students when they take the training. We call it the CRT choice, the cranial release technique choice. And again, if I were going back into practice, I would have this poster right on the wall. And the first thing after I took the history, what's going on, how long is it bothering you, all the questions that we ask. And then I would want to explain to them what it is that we're going to do with the cranial release technique. And I show them this poster. And they look at it for a bit. And I always ask them, if you had the choice to be figure number 1, figure number 2, or figure number 3, which would you prefer to be? And they always say, the one in the middle. And I ask them why. Well, I'm not sure what I'm looking at, they'll say, but it looks better, it looks balanced, it looks healthier. Okay, fair enough. Good answer. Let's assume that the patient comes in on that first visit, and one of the tests I do a few different tests, especially on the first visit. I want them to feel a change before and after. And I, as the practitioner, also want to see a change before and after. So what I'll sometimes do is, let's assume we'll lay them on their back so they're face up, and I'll check the legs. So I'll come at the bottom of the table and I'll check the legs. I'll put my hands this way so the camera will catch a little better. And let's just assume one of the legs is shorter. It doesn't matter if it's the patient's right leg, the patient's left leg. It's the same principle. So just to make it simple, let's look at figure number 1. Figure number 1, here we'll have a right short leg. This is obviously looking at the patient from the back. Ideally, they would be face up on the table, but I'll just use this, pretend the patient's face up on the table. And I check the legs and the right leg is short. Okay, I check the legs. One leg is shorter. I'll then usually go in, as I mentioned before, I'll turn them in, and the shorter leg will also be the tighter leg, the more restricted leg. So in figure number 1, we'll have this right leg will be shorter, the right leg would be tighter. If I went up to the iliac crest, to the pelvis, and palpated them at the pelvis level, here, I think the camera will catch that. That side of the short leg will also be the high pelvis. Many times that will also be the high shoulder. So you'll see a patient, one shoulder appears to be higher than the other. Obviously, I'm exaggerating here. And then I'll apply the cranial release technique. I'll do the left side, I'll do the right side. I always do both sides. I train you to do both sides every time. And I'm expecting them to shift into the middle diagram. And the middle diagram, you see here that the legs are balanced. The legs turn in evenly. When I turn them, they come in evenly. The pelvis is balanced. The shoulders are balanced. So what did we do? And how did we, by addressing the cranium, affect everything down the line? And then if you went in and did a muscle test, you should see improvement. If you did some sort of reflexes, you should see improvement. If you did some sort of motion palpation, static palpation, whatever your analysis was of that patient, you should see improvement. And if you do see improvement, and with my patients, I'm done for today. That's it. I'll see you on the next visit. Rome wasn't built in a day. And many times when this patient comes in, they've had problems for 20, 30, 40 years, depending how old they are. They'll give me a history. Oh, when I was 3 years old, I fell off the tricycle. When I was 10, I got into a fight and got knocked out. All the things that have happened that have compiled and damaged the system that we're now going to start to help repair with cranial release. So I'm not expecting all this. I'm not expecting them to come for one visit. I want to see them one time, the first time, make my correction, have them go, live their life, and I'm going to see them either in a few days or in about a week. We're going to reevaluate them. But I want to explain why this all changed, and that is because we changed the brain at the hemispheric level. So if we go back to this figure number 1 here, we saw the right leg was short, the right leg was tight, the right pelvis is high, the right shoulder was high. That's all secondary to the left brain being overactive because of stress. The patient's left side was overactive because of stress, constant, chronic, low level, and many times high level stress. Physical stress, chemical stress, emotional stress, EMF stress, gravity, you name it. It all leads to stress in the body, and at some point, one hemisphere becomes overactive, one hemisphere becomes underactive, and that figure number 1 is showing that the left brain is overactive because of stress, the right brain is underactive. Contrary to that, if we go to the third photo, here it's just the opposite, where the right brain is overactive, leading to a left high shoulder, a left high pelvis, a left short leg, a left tight leg. I apply the cranial release to that patient, and again, the goal is to get them in the middle. And when they're in the middle, some wonderful things happen. So the cranial release changes hemispheric activity in the brain. And we then go, and I explain this to the patient again with this one poster. Before you're in this chronic stress state in figure number 1 and figure number 3, now you're in whole brain function. And when you're in whole brain function, your muscles are balanced, the structure is balanced, and the central nervous system and the parasympathetic, sympathetic nervous system are balanced. Now you're healing, repairing, regenerating. When you're in figure number 1 or you're in figure number 3, the tendency is, if we go and just read here, you're in this chronic stress, you have one brain overactive, left or right, you have tension on one side of the body, you have imbalance in the structure, and again, now you're shifted to the sympathetic nervous system. You're surviving, protecting, defending. You've all heard of the fight or flight mechanism. You're sort of living in that fight or flight mechanism, and that is not a good place to live in. So we want you to live in the middle, healing, repairing, and regenerating. Healing, repairing, regenerating new tissue, new organs, new systems. Everything's constantly being regenerated from the brain. So that's where I want you to be. And then, of course, the stresses are still going to come, the physical, the chemical, the emotional stresses, and you're going to shift into figure 1 or figure 3. But the good news is, in my experience with more CRT, the tendency is you're less likely to go to shift to 1 and 3. And when you do shift, you come in and we put you on a program to keep you in the middle. The goal is to keep you in the middle. Live your life, climb mountains, ride your bicycles, ride the dirt bikes, swim in the ocean, do all the things you want to do that makes you you. But take 5 minutes a week and come in for a cranial release technique to balance the brain, to balance the structure, to enhance your life at every level. Okay, I think we covered that pretty good. The website again, cranialrelease.com, cranialrelease.com. If you're a practitioner, you can search there for the online training program. You can learn about how it is in the modules that we have set up, and the manual, and the posters, and the patient education material. You could take this information, study at your own pace at home, bring it into practice, and be very successful with this. So that's for the practitioner. For the patient, for those of you non-practitioners that would like to experience this and say, hey, maybe that's why I'm in number 1 and number 3. Maybe that's why you suffer with migraines or back trouble or digestive issues or emotional issues, anxiety, whatever it happens to be. Everybody's better off in the middle based on these 3 diagrams that we have here. I ask a 5-year-old child or a 90-year-old man, they all say, I'd rather be in the middle, and I think you would be too. Again, cranialrelease.com is the website. Still up here in New York, enjoying the beginning of the summer, end of spring. Hope Mother's Day was nice to everybody. Be well. Hope to see you down the road. cranialrelease.com. Over and out. Adios, my friends. Goodbye.